Welcome to HCS 5890. This is Turfgrass Seminar class. It's done online. The focus of this class is really on case studies. And what I've developed is several case studies that you will solve. In other words, you'll be like a consultant to these golf courses or athletic fields, and looking for keys and information that's provided through this case study. I'm looking for you to determine what the problem is and then come up with a recommendation for its control. So I thought I would work through the first case study to kind of show you or give you a guide of how this may work. So we'll get started with this example. Here we're on the home page of 5890. Go to modules. Here's our first case study. Have a description of some of the diseases that could be the problem associated with this case study. Obviously, this case study is a disease diagnosis from Florida, so it really limits, or doesn't limit, but focuses what the problem is in. Also, too, sometimes I'll put in a helpful aid. This is from HCS 3475, Turfgrass Diseases Interactive. If you go to this section, it's a review of the organisms that can cause turf diseases. If you go to the fungi one, and then identification of diseases. This goes step by step in the process of diagnosing a disease, which can add valuable background if you're not familiar with it to doing these case studies, at least case study 1 and case study 2. And we'll go back. Okay. So here we are. Again, as I mentioned previously, it's like you're being the expert or consultant who's going to help this, in this case, this golf course solve its problem. As you can hear my dog in the background. Case studies, most of these are organized the same way. The beginning part really is a description of what you need to include in your report, which you'll upload once you've figured out what the problem is and come up with some recommendations for control. And that's what this description is for. And it gives you a brief outline how you're going to do this one-page report. And in the case of this one, the name of the disease, the pathogen or the organism that causes it, the host, what did it occur on, and we'll see some keys here shortly how you can figure that out, and then how you can control or manage this problem, or what you would recommend to this golf course what they should do. And a lot of this information will come from those handouts on specific diseases once you've identified them. And then you'll upload it to me. I'll grade it and send it back to you if it's wrong or incomplete, and then we'll go through a revision process of trying to improve it. So if you keep doing it, eventually with these case studies you'll get the right answer. So this section in here is all just a description of your report and what you want to do. So if we go to our first one, disease diagnosis, again, the introduction to this animation is basically what I mentioned previously in the description of the case. Good places to start with is where's the location of the problem, and in this case it's in Naples, Florida. That's kind of a key because now you're in South Florida, very tropical environment. The problem is on a golf course green, so in a lot of ways that helps you narrow down the host, because putting greens are either going to be Bermuda grass, hybrid Bermuda grass, or seashore paspalum in general terms. They might be overseeded with Poa trivialis or overseeded, but the main gist of this is it's either probably going to be hybrid Bermuda grass or seashore paspalum. And so let's continue. So we walk out onto this green. It's hard to see, but it's pretty, has a number of shaded areas, things like that, which may help you here in a little bit, give some management strategies. But one key thing is to know is what's the date, when is this occurring, and the weather. And here it is. The problem we're standing on is February 18th. And prior with this disease, and by the severity of the green and losing turf, it's probably gone on for a week or so. And if you look at the temperatures, mid 70s during the day, down into the 50s at night. Now, that might be nice here in Columbus, Ohio, and that's excellent for other cool season grasses like creeping bentgrass. But that's pretty cool weather down in South Florida, especially for growing Bermuda grass or seashore paspalum. I'm checking a few things. So we have basically cool weather. They don't give the rainfall, but they supplement with irrigation. So it's relatively cool. So we know this disease probably occurs during the cool part of the season on Bermuda grass. What is the turf grass? Well, by knowing the location, and for this we can fairly well narrow it down to, again, whether it's Bermuda grass or seashore paspalum. And if you look closely at these plants, you can see that they have hairy structure, especially around the ligule fringe of hair. And with Bermuda grass, the ligule has a fringe of hair, and the leaf blades can have hair growing along it. And you can see the hairs here. So obviously, you're probably thinking, it's Bermuda grass. Seashore paspalum also has hairs along the ligule, but it has a membranous ligule. So in other words, you can see that ligule. So actually that's a pretty good diagnostic key for seashore paspalum or identification. But in this case, because of that, this is Bermuda grass. So here we are, winter time in South Florida, February. If we wanted to see more, we could have. Okay, and we're on Bermuda grass. Okay. Now we can look closely at the symptoms. As you can see, the green part is the healthy turf, and then this off color, purplish or orangish color is the infected turf. If you look a little closer, you can see the patches or small spots. So we have a spotting type disease. We can look a little closer. We'll look at the leaf blades. The leaves, as you can see, have a purplish tinge. And if you look closely, you can see some lesions on them, bleached out center, purplish border, or a darker color border around them. Again, that's a characteristic of this disease. So we can return. So right now, the problem again is a spotting type disease, pretty aggressive. Could be a thinning of the turf, purplish tint to reddish tint, and spots on the leaf blades. Okay. Oftentimes you can send samples in to labs, plant disease labs. They'll diagnose or culture the pathogen from the infected tissue and do an ID for you. Actually, some golf courses have their own diagnostic labs where they can do some of those activities. But most of the time you'll send samples out to an expert or whatever, maybe, to get a diagnosis, all right? And what I've done here is taken a slide of these spores, and I've circled them in with 4 different colors, all right? And one set of these spores is the pathogen for this disease, or what we're seeing on this Bermuda grass turf in Naples. And if we go through these, look at the shape here, circled by red, of these spores, and to add some kind of challenge to it, I've put 3 different pictures of spores up here, and you can say, well, you know what, which of these looks like the spore that was circled there in the red? And it looks like this one, and Pyricularia griseae. Okay, so that's a pathogen, maybe, for this disease, maybe not. Okay, it's one of those 4 that's the real pathogen. So you might make a note of that. You could go look it up, what disease it causes, and what are the symptoms, things like that, see if it matches up. But we'll come back to that. All right, so again, we can go through this again, and now maybe it's this spore set. All right, and again, this is a little tougher. Kind of looks like this, but more likely looks like this. If you're to click on one, and in this case, it's not this one. It's Microdochium navale. All right, maybe, but you could look that up. Actually, it's probably more closely related to this one, Colletotricum cereale. If you remember 3475, this was the cause of anthracnose. So, is that a possibility? Well, we'll need to look that up too. And again, we go through Ascota blight, probably like this one. Ascota gramine. Does cause a disease, usually a warm weather disease on cool season grasses, which is probably not going to be the likely cause of our problem. But again, you get the idea. So it's kind of like identifying these different pathogens by their spores from this one picture, and then trying to tie it in with the disease, and does it cause these symptoms or occur on these grass. And then the last one here, circled by the yellow. Again, we saw this prior. It doesn't look like that. It looks like this. This is Bipolaris synodontus. Okay, and Bipolaris actually causes a lot of leaf spotting type diseases. So we have 4 potential pathogens. We have our symptoms, our host, and now we need to try to identify or put it together. Okay. So let's go back. Go to the module. And down here we have multiple type of diseases I've listed. You could look at all of these, which you probably would if I wasn't telling you basically what it's going to be. But here I have anthracnose, usually a hot weather disease on cool season grasses. Ascota leaf blight I mentioned before, probably not that. Dollar spot doesn't form spores, but we can look at that. Gray leaf spot, a possibility. Microdochium, which is Microdochium patch, a snow mold. Again, probably not that one, but we have a bunch of choices. And actually, if we go to the leaf spotting handout, this is from North Carolina State Extension. It takes a second for it to come up. Okay, leaf spots and diseases. Leaf spotting occurs, or this pathogen can be Bipolaris, Dreschelaria. A bunch of them fit into these leaf spot pathogens that cause these leaf spotting diseases. And we can quickly see that actually it occurs on Bermuda grass. One of them is Bipolaris synodontus, which is the pathogen, was one of the 4 pathogens. And so that's a good indication. It's leaf spot of Bermuda grass in this case. And here it describes the development factors, which really cool weather fits into the temperatures down in Naples. Bermuda grass is a host. And then cultural control measures, what we can do to minimize this disease. Things like, don't over-fertilize, again, especially on Bermuda grass during this cool weather or wintertime period during the year. Promote air movement so the turf stays drier and not as wet. And there's some other things that you can do. So you would make note of those, try to draw it into this overall image of this golf course. And then here we have chemical controls, lists, and in this handout, the top ones were based on stars from the evaluation of their studies and efficiency rating, and if it's 4 stars or 4 of these plus signs, not stars, then you have excellent control. So there's a number of possibilities down here to choose from. Come up with combinations or whatever. But what I would look for, let's say, take this as an example. Oxystrobulin, there's some other trade names by it, but Heritage. You would put the rate in that you would use and the interval that you would retreat through these cool weather. So that would be the recommendation. So again, that's basically it. So you go back to the case study, and so here in this report we'd identify the name of the disease, leaf spot of Bermuda grass, pathogen, Bipolaris synodontus, the host, Bermuda grass, that's what the turf was, and then here we would put a description of how we would control it, both culturally, yes, promote air movement, don't over fertilize, maybe mow a little higher, promote, again, air movement, those kind of activities, and what other things that might help describe that. Keep the turf dry, and then chemically what you would recommend. I would recommend to this person we use this product or this combination of products, and the rate and the interval. You probably, in this case, since the disease already occurred, you'd probably be using a higher rate to control it preventatively. If you've written that up or typed it up on a Word document, again, no more than a page, upload that through your option in the case study course, and then I'll take a look at it, grade it, send it back with comments, and that's a good point where we work through it, and once that's completed you get full credit.